Good morning, everyone. I'll go ahead and get started, and I'll admit the late comers if there are any, but I want to be respectful of everyone's time. My name is Peggy Determeyer. I am the McGee Fellow and the Director of the Community Bioethics and Aging Center at the Hope and Healing Center. And we match the Hope and Healing Center's services of providing educational opportunities and coaching and research in mental health with an emphasis on aging. And this is the third of our 4-week series that we offer a couple of times a year on Aging with Grace. And today I'm going to be talking about living options. Living options are become an issue as we get older. Most of us want to stay in our own homes. That would be our preference. Unfortunately, there are times when that's not an option, either because of the health or increasing capabilities, either mentally or physically. We'll talk some about independent living. Many people downsize. In fact, we had a session a couple of weeks ago on how to downsize and how to go about looking to divest of some of the possessions that we have gained over time. And that particular session is available on the Hope and Healing Center website. Sharon Staley was the presenter, and it was quite an interesting session. I actually learned quite a bit. My husband and I have moved a couple of times over the last 5 years, and some of this we learned by trial and error. But she had a lot of good suggestions, and so I would commend that to you if you're interested. Adult daycare is an option. We'll talk a little bit about that and what the costs are, what the service offerings tend to be. We'll talk about home health, assisted living, skilled nursing, and memory care and personal care homes. All of these are different options that would be appropriate depending on what your capabilities or your loved one's capabilities. Some of us are, even though we're not looking for assisted living for ourselves, we may have aging parents that we have to help. As an example, my dad made the choice a few years before he died to move into assisted living because he was no longer able to live alone. And having 24-hour care, even with long-term care insurance, was quite an expensive option for him. So we're going to talk about all these different things. I'll take questions at the end. I hope our session is being recorded. I'm not sure it is, but if it is recorded, it will be on the website and within a couple of days, and you can take a look at it. So what would we prefer? Well, clearly, most of people, surveys show that most people want to remain in their own homes. The number's pretty high, somewhere around 80%. But the consideration is health and safety, because as we age and become more frail, it may not be practical for us to stay in our own home. One of the considerations are things called activities of daily living. And if you Google activities of daily living, you'll see a bunch of different lists. Some say they're 6, some say they're 7, some say they're 13. The number is all over the map. But the important activities are dressing, bathing, meal preparation and eating, ambulating or walking, Transfer refers to transfer from bed to other areas like a chair, toileting, and hygiene. So these are things that we need to be able to do to function on our own. And when we're no longer able to function on our own, we have to think about what different options might be for us and how we're going to continue to function. This is also important because as we age, and we're going to talk next week about long-term care insurance, when you want to activate or need to activate long-term care insurance, the ability to do that is predicated on the number of activities of daily living. Most of the policies require that you have issues with at least 2 of the items of this 6. And so that gives you an idea of what to expect. If you have a long-term care insurance policy, I strongly encourage you to look at the fine print, to read the policy to see what the requirements are to activate it. So how do we think about how we live? The first thing is what you're doing today by being here is to think ahead and think about the options that you're going to have and to research those options to figure out what the best fit might be. Then to discuss it with your family members and implement a plan. In some cases, like I said, you'll be doing this for yourselves. In other cases, you'll be doing it for a parent or other family member. And so these are important things to think about. So independent living options are designed for those folks who are mostly or fully independent. That means you can get up, move around, give yourself a shower or bath. You can fix your own meals. You can cook. You can fundamentally do everything on the list of activity of daily living that we talked about or that I described a few minutes ago. There are other names for these options. You'll see them advertised as senior apartments or senior retirement communities, even retirement homes or active senior communities. There are a number of these around Houston. In fact, I was just looking at a newspaper this morning, a little monthly paper that's published out of Waco that's targeted for seniors. And fundamentally what it is a bunch of ads for different senior communities. The cost varies by size and by amenities. In some cases, they advertise, the number of tennis courts and swimming pools and gyms, amenities fundamentally that some people are interested in as they think about moving, to have everything in one place. If you, the regular senior apartments are, as I said, they're scattered all over Houston and they're advertised as such. And you're expected to be able to function on your own. I have a friend who was living in one, and she ended up being frustrated with that particular facility because there were people living there who really shouldn't have been living there. And that's one of the things to watch for, is to see how the people are functioning that are living there. If there are lots of people with walkers and who are mobility impaired, it's important to see because that may affect the way your own enjoyment is from the people you're living around. Senior apartments are, some senior apartments are geared for residents age 55 and above who are fundamentally independent, and self-reliant, but they'll also offer a few basic services such as transportation, housekeeping, and trash pickup. Uh, they start at about $1,200 a month, but they vary in price. Some of these facilities are included uh, with subsidies for low or sliding scale rent. And they offer a quieter living options for seniors who are fundamentally independent. One of the things to look at is the Area Agency on Aging keeps a list of some of these facilities, and they can also help you if you need to apply for subsidized housing. We'll talk more about the Area Agency on Aging next week because they have a lot of resources for all kinds of helps as we're aging. It's a service that's funded by Center for Medicare and Medicaid Services, um, and there's a county office and for every major county in Texas, and so they're all over the place, and they offer a good place for getting advice. Um, then the next step up are more organized senior retirement communities, also geared for those who are 55. Um, they offer generally private apartments with some level of kitchen arrangement, but typically the kitchens tend to be simpler. There won't be a very large kitchen, and instead of a 6-burner range, they may have a 4-burner range and a small microwave and a smaller oven. The costs again vary. There may also be some rental assistance programs. They include government-owned public housing, and housing, and will accept housing choice vouchers. My mother-in-law lived in Michigan, and she lived in a retirement community, and they had lots of amenities, but they also had some organized activities. But they did bring her meals to her apartment so that she didn't have to worry about cooking. She had a tiny kitchen where she could basically make coffee and have a snack, but meals were generally provided for her. Home care is a service where either agencies or individuals provide service to someone in their home. The services are typically offered by the hour, and folks are generally targeted to be non-health workers to help with meal preparation, housekeeping, and transportation. There are many agencies who provide these services. Some of you may have seen some of them advertised on television or in the newspaper. The cost will be if you go through an agency, it's typically about $23 an hour. If you just look for someone directly, it's $10 to $15 an hour. The thing to remember is if you're going to hire direct, then you have the personnel problem of if somebody calls in and says they're not coming and you've already planned for having them be available and they call you up and say, no, we can't come in today. If you're going through an agency, they'll typically have backups so that if someone gets sick or isn't able to come to work, they will be able to replace them. Some home health provides clinical and medical supervision so that The folks are allowed to administer medication or help with wound care or rehabilitation. Again, this depends on the service that's been required. As we'll talk about next week, some Medicare provides home health if it's prescribed by a doctor. And that can make life easier for you when someone has home health needs. A home health aide costs about a little close to $90 a visit, or about $4,400 a month based on a 44-hour week. So it's important to pay attention to what your needs are going to be and how you want to have those needs serviced. Adult daycare is, I don't want to say it's relatively new. The Amazing Place is one place in town that offers daycare services for those with early to mid-stage dementia. And they offer a variety of services and activities. They're actually getting ready to reopen on April 15th. They've been closed for the past year because of the COVID virus and had to switch their services to a virtual environment. Happily, I think after they reopen, they're going to continue some of their services in a virtual environment for people who aren't able to travel or don't feel quite safe going into public spaces yet. But they're an example. They do a super job. And Baker Ripley has a daycare facility for those with dementia. In fact, they will take people once they no longer qualify at the Amazing Place. And there's some other facilities around town. You just have to check for them. The starting cost is about $75 a day. Some folks, like if you're at the Amazing Place, you'll get a discount if you go more days versus fewer days. But you have the choice of just having your loved one go one day a week. Their clientele is all over the map. They're folks who stay or who come 5 days a week so that their family members and caregivers can work. Assisted living provides housing and care to seniors who need some help with daily tasks without need for skilled care. So I like to use my dad with this example. By the time he was no longer able to live alone, he was still pretty mobile. In fact, at one point he was still driving, but then the doctor put the kibosh on that and told him he could not drive anymore. But he got help with his medications. Of course, his meals were provided. Somebody came a couple of times a week and cleaned out his apartment so that he didn't have to worry about vacuuming and cleaning the bathroom and that sort of thing. They will typically, most assisted living facilities, charge a flat rate that covers the basic services, which is room rent and meals. And they start at about $4,000 a month. But then they have a sliding scale based on the number of tasks you need help with. At my dad's place, which was in Jackson, Tennessee, they had a point system. So it was very transparent and straightforward that when you needed, for example, as he got older, he needed more help with showering. And so that added more points and that increased the charge that he got. Some of the facilities have entrance fees and deposits. Some of those you will get back when you leave if it's just like if you rent an apartment. A lot of these facilities have lots of social activities and as well as transportation to shopping and appointments. So at my dad's place, they had regular bingo games and they had other kinds of games. They had movies, movie activities. They had um, just a variety of things. They would have celebrations for special days. And they also provided transportation. They would go, if they had a group that wanted to go to Target, they would take a group to Target. If my dad had a doctor's appointment, they would take him to his doctor's appointment and drop him off, and then he would call them when he was finished and they would pick him up. And it worked out really quite well. He he wasn't one for the activities that they offered, but they did a really good job of trying to keep the socialization strong. Of course, we've read about all the problems with the past year because senior facilities were one of the groups hardest hit by the virus. And in fact, I read a statistic over the weekend that about 40% of the deaths occurred in senior facilities. Or occurred among residents of senior facilities. So a lot of them have curtailed the activities, the group activities, and also curtailed visitors, which has been a problem. So skilled nursing is the next level up. That is for folks who really can't go anywhere by themselves. They need skilled care around the clock. And it can only be, these are services that can only be provided under the care of a professional or a technical person. They're typically offered in private or semi-private accommodations. Some of the facilities offer more extensive, a one-bedroom apartment kind of thing. But typically it's just a private or semi-private room with a bathroom. Most of the time it's a private bath. Sometimes it's a bath shared between two rooms, depending on the kind of fanciness of the facility. It can be for a short-term stay, which would be rehabilitation following a healthcare event or surgery, or it can be long-term. As we'll talk next week, if it's a short-term stay following a health event or surgery, then Medicare will pay for some of these stays. But in general, if someone requires skilled nursing for the rest of their lives, Medicare does not pay for that. And so we'll talk more next week about how to pay for some of these services. The costs start at about $7,500 a month. They could be combined with Medicare, memory care, or be standalone. Somebody just needs skilled nursing help. It varies. The facilities, when you'll sometimes hear it referred to as a SNF for skilled nursing facility. Also, some folks will use nursing home, but it's important to differentiate whether they're talking about a nursing home, or if they're talking about one of the other kinds of facilities, and they kind of lump everything under nursing homes. But a skilled nursing facility offers very specific services where the degree of intensity of care is a higher level than it is in an assisted living facility. In an assisted living facility, you'll have maybe a practical nurse, a registered nurse, may or may not be in charge. It depends on the requirements of the state. The facility my dad lived in Tennessee, the head nurse, as they called her, was not a registered nurse. She was a licensed practical nurse. And in a skilled nursing facility, you'll have at least one, if not more, registered nurses on staff, which of course adds to the cost. Memory care is for those who need help either in a secure area of an assisted living community or in a skilled nursing facility. And you will hear the term locked unit. And that's a security measure that's provided so that residents who are prone to wandering are kept safe and kept contained within the unit. Now, that's not to say, for example, my dad's assisted living facility required a code to get in and out, and the residents who were able to go in and out were provided with the code, or the person at the desk let them out. But fundamentally, in a memory care unit, everything is geared to the security for folks who have memory issues, dementia issues, and the staff is specially trained to assist with activities of daily living for those who are not able to function for themselves. And the care is targeted to a resident's specific needs. Now, the costs, strangely enough, the entry-level costs for some memory care at an assisted living is more than an assisted living. Remember, I said it was started at about $4,500 a month, but it goes up and pretty quickly if the person needs skilled nursing. Again, the start is about $5,500 a month, but I have talked to people who are paying $10,000 a month or more for memory care. Personal care homes are a smaller environment. They're residences that provide shelter, meals, supervision, and assistance with personal care tasks. If you are in Texas, facilities with more than 6 residents are licensed by the Texas Department of Aging and Disability Services, according to their size and type. The cost can be quite a bit less than the larger facilities, but the range is quite large. So the average cost can be as low as $1,500 a month, or it can be as high as $10,000 a month. My mother-in-law lived to 108, and for the last several years of her life, as she was more frail, she lived in a personal care home in Michigan. And it was run by a woman who had been a nurse, a registered nurse in her working life, and decided to do this and got several family members to help her. And it turned out to be a great place. It was cheaper than a skilled nursing facility in Michigan, but it was also a little more personal. That, with a smaller group living together, it was more like an extended family than a skilled nursing facility. So this can be a way to keep yourself or to take care of your family members. And does someone have a question? Okay, would y'all please mute yourselves if you don't have a question? We're getting some extra background noise. So how do you think about everything that we've talked about? it starts by figuring out what your needs are or what your family needs are. One of the best ways to get information is to talk to friends who have, or family members who have had to use these kinds of facilities. Clearly, if you go to a nursing facility, you're going to find different things, and different people will have different perspectives. Medicare has a nursing home compare website. I've given you the link here. It's not perfect, but it's really good for finding information for different places within a geographic area, and it will at least give you some basic information. I strongly encourage, if you narrow down to a facility, that you visit it at least twice. Visit it with an appointment, and then you'll get the full tour, and you'll get a fancy you'll have the director of marketing showing you around and bragging on their facilities, which is great. But it's also good to go without an appointment and just drop in either in the evening or on a weekend. The weekends are the weak links of most places because a lot of their standard staff is off, and they'll only be operating with a a skeleton staff on the weekends. So it's important to know what really goes on the weekends, and see for yourself. One of the things is to use all of your senses when you visit a facility. Look around, use your vision to see how people are sitting. Is everybody just in a common area, slumped over and asleep in their wheelchair, or are people engaged and talking to each other? One of the things is a sense of smell, because if you excuse me, if you have a particularly strong smell of cleaning agents, then they may be using that to cover up some of the other smells that happen in a facility where lots of older people are living who may have continence issues. Check the online reviews. It's not a perfect system, clearly, but if you see continuous bad reports on some place, you may want to check around. You can also check with the DADS website, the Department of Aging and Disability Services. They keep a complaint listing in Texas for all the facilities with repeated problems. In case of problems, the Harris County Ombudsman's Office is a great help. They have a requirement to visit all of the Medicaid supported facilities, and we'll talk next week about what that means and how you're eligible to get those. You can also make complaints to the Texas Department for Aging and Disability Services. The Texas Attorney General has a criminal abuse and exploitation web line. You can contact your congressional members. You can also contact the Better Business Bureau. Jennifer Salazar does a great job of tracking issues with Medicare and Medicaid fraud, and she'll be doing a presentation the third Thursday in April at noon on how to what to do when you suspect Medicaid fraud for your loved one. But these are great resources to keep track of as you as your as you are aging or as your loved one is aging. If you have a problem, give them your name, your address, and your daytime phone number, your relations to the person, the names of the persons involved, the provider name, and then the nature of the complaint. When did it happen? What happened? What was the harm? And then who were witnesses and who else might have relative information. All of this is helpful uh, to the investigators to check into what's happening. Here are some resources. I've already mentioned the Area Agency on Aging. They're nationwide. I've given the website for the Houston one here. Genworth has a cost of care survey that they publish annually. It's important when you read this. They also have an online calculator for different kinds of services and whether they're hourly or monthly or annually. It's handy to use if you're trying to figure out what cost level you need to plan for. I've given you the website here for the Medicare Nursing Home Compare. They also have one for Hospital Compare. And then finally, the Texas Department of Health and Human Services. They keep a running list of all of the long-term care provider searches. Again, they won't have personal care homes listed unless they have more than 6 residents beyond the caregivers. I'm going to stop the share. Oh, here's my information, my email address and my telephone number. My email address is pdetermeyer@hopeandhealingcenter.org, and my phone number is 713-871-1004, extension 206.